Hey, this is Different Careers with Kate Nudd. Again, we are going over massage therapy principles and practice. This is chapter 7. Maybe some of these videos I will put together. We will see. But sorry for the glare in the other video. I had to change how my computer is. But as you can see, there's still a glare, so feel free to buy the book and check it out. We're going to go over body mechanics. It's 8 minutes and 37 seconds. So let's see if this glare is better than the one before.
Career in massage, the therapist must learn and use proper body mechanics. This includes the practice of foot stances, body postures, and leverage techniques to enhance treatment effectiveness and reduce the risk of injury. Body mechanics is the proper use of postural techniques to deliver massage therapy with the utmost efficiency and least amount of physical trauma to the therapist. Also known as biomechanics, body mechanics influences the execution of the massage, decreases fatigue and discomfort during and after the massage, and helps prevent repetitive motion injuries. The key to a long, healthy career as a massage therapist is the ability to provide treatment without incurring injury. One way to prevent injuries is to prepare yourself for massage through warm-up. Just like in sports, muscles warmed before massage are less susceptible to injury. Some movements designed to assist the therapist in preparing the shoulders, wrists, and hands before massage are presented. Let's begin with simple movements. Other important tips are: relax your shoulders. For any stance, help keep your upper body in correct alignment by not hunching over or rounding the shoulders, and try to keep them over your hips. Avoid raising your shoulders toward your ears. Keep your upper arms close to your body whenever possible. When your upper arms are far away from your body, they tend to fatigue faster. Avoiding arm fatigue is often accomplished by standing close to the table. Use straight wrists and fingers. Keep your wrists as straight as possible. At times it will be necessary to flex and extend the wrist, but remember that the greater the pressure, the straighter your wrist should be. When you are not using them, your wrists and fingers should be kept relaxed. Do not let fingers become hyperextended while applying direct pressure. Use braced finger and thumb techniques to avoid joint hyperextension. Stand behind your work. Position yourself as much as possible directly behind your work. Both arms and legs should face the direction in the area you are working or in which pressure is applied. Lean or sit. Lean, sit, or brace yourself against the table when needed. A stool can be used while performing footwork, neck work, facial routines, or hand work. Keep both feet flat on the floor with your back straight while seated. This maintains a stable base and reduces strain on the upper body. Align the spine. Keep your spine in correct alignment by maintaining your head over your neck and shoulders. Move your body as a unit. Avoid forward head posture.
Okay, so here is an example of the drape falling down, and the massage therapist is going a little bit under the sheet. In massage therapy school, I was told that was a no-no. Again, you have a perfect example of sheets don't always cooperate, so you do need to use more caution if they fall down. So if you go a little bit under, I did that, and there were no problems. So, but it's like you have to be extremely careful with the draping. The sheets don't cooperate, Why don't they stay in one position the whole time when you thought you secured it tightly? The client could move their leg, their arm, their waist, and so you would have to either continue your work a little bit, readjust the drape, or what's the word? Uh, keep fussing with the sheets, and that's going to interrupt the massage. So, clients, if you're looking for a spa or massage therapist, hey, if you can lay still as possible, within reason, and try not to move, like move the other body part, or the other leg, or the other arm. That would help out the massage therapist. Try to do other gentler movements with other areas of your body, so that way the sheets can stay uh, um, uh, is secured in the spot that there is. You may have to experiment with you and your massage therapist to see what works for you. But this can cause problems of the sheet falling down, because if you have to keep redraping, like you're trying to give as much hands-on time as possible, if you're in a hurry to redrape, then accidental exposure could happen. So it's like, yes, please help the massage therapist to make sure you are draped properly, every limb, every single area that's worked on the body.
When working on a muscle or group of muscles, keep your eyes forward, your neck straight, and your head erect. If you spend a great amount of time looking down, your neck may become stiff. If you must observe your work, lower yourself to the level of your hands by kneeling down on the floor or sitting on a stool. A pillow may be used to elevate the feet for proper body mechanics. There is more involved in keeping the therapist injury-free than proper body mechanics.
Also, again, see how close the massage therapist is? This is really close to your nose, clients, or the massage therapist. This foot is very close to the massage therapist's nose region. So if your feet are not clean, if they do not smell nice, we will smell your feet. You cannot hide it from a massage therapist. We know who takes proper care of their shoes or wears socks and who does not. So, also, some people have come in to massage therapy sessions with dirt on their feet, with the grimy feet, and they did not wash their foot before the massage. So it's like, yeah, maybe baby wipes should be a requirement for the feet before you get a massage, if they aren't nice and clean, if you didn't take a shower before coming to receive a massage. So just a side note.
Important items are: use proper table height. Proper table height supports body mechanics. If the table height is too high, the therapist has a tendency to raise the shoulders. If the table height is too low, the therapist has a tendency to lean over excessively. Proper table height allows the therapist to use his or her weight rather than strength to increase pressure. Stand by the massage table with arms to your side and make a fist with your hand. You will know the table is at proper height when the table just touches your fist or knuckles. Wear comfortable attire. Wear sensible supportive shoes with low or no heels and good arch supports. In addition, clothing should be comfortable, allow the therapist freedom of movement, and look professional. Cotton clothes are best because they absorb the body's perspiration, which helps keeps you cool. If a cotton polyester garment is worn, a 100% cotton t-shirt can be worn under the top. Use a variety of strokes. Even with the use of proper body mechanics, body tissues react negatively when the same motion is repeated excessively. Most massage routines incorporate an assortment of strokes. Changing from effleurage to pétrissage, to tapotement or tapotement, to friction requires the therapist to change the position of both hands and feet, thus reducing fatigue and repetitive motion injuries. As the therapist, you must also listen to your own body. If the right forearm is fatiguing, use the left arm more. If compressive movements are irritating wrist and knuckle joints, change to a lifting move such as pétrissage. Stretch during the massage. Look up, out the window, or at the corners of the ceiling occasionally to stretch the anterior neck musculature. Experiment with different head and neck positions for different massage strokes to discover which positions are more comfortable for you. Breathe. During the massage, use deep, full abdominal breathing. This will aid in self-relaxation and helps keep a steady pace with your massage strokes. Apply the pressure stroke during exhalation and the return stroke while inhaling. While you breathe, be aware of facial expression. Keep your jaw unlocked and your forehead relaxed. An important element in a massage therapy session is body mechanics, which refers to personal health care and the proper use of postural techniques to deliver massage. As we have seen, there is more to giving a massage than how to stand properly during treatment. Let's review by asking yourself the following questions. 1. Is your massage table the correct height for you? 2. Are you warming up before your first massage of the day and stretching between massage sessions? 3. Are your knees slightly bent? 4. Are your feet firmly planted on the ground? 5. Are you shifting your weight as you move, working with your whole body? 6. Are your wrists straight? 7. Are your thumbs and fingers supported while applying direct pressure? 8. Is your back straight? 9. Is your head centered over your neck and shoulders? 10. Are you using a variety of strokes in your massage? Are you positioning yourself behind your strokes? 11. Is a stool nearby to be used during facial and foot massages? 12. Is your face relaxed and your jaw unlocked during the massage? 13. Are you breathing deeply during massage? 14. Do you stretch to keep yourself relaxed during massage? 15. Are you wearing comfortable garments and shoes? If you answered yes to all these questions, you have reduced your risk for stress, strain, and injury through proper body mechanics.
Okay, so again, going over a little bit for body mechanics. Okay, for table height. Okay, the lower the table can go, the more pressure you can give. The higher the table is, the less pressure you can give. So that means you need to adjust your table accordingly to each client and figure out the proper table height for each client. So there's different kinds of tables. The best table is the one that has some kind of foot remote where you can automatically lower it higher or lower based on your client. Otherwise, you play a guessing game with a table that has holes and you have to up and down the leg hole thing of the table. Um, the other thing is in your own office space, I did sometimes take my shoes off, just wore socks. In the summer, I did go barefoot. If you're taking a shower every single day, if you're wearing flip flops, I never went for a hike before my massage. So it was like shower, get dressed, eat, go to the office. My feet never smelled. So that was fine. However, in employee settings, they're like, you need to wear shoes. Um, so all shoes are not necessarily good for massage. All shoes are not necessarily super comfortable to stand in or walk in or hike in. So it's like good luck wearing good shoes that support your feet. So there are flat shoes. Those were like the worst if they were completely flat. There were shoes that you could put all your toes in that had like an arch. That seemed okay for massage. However, they didn't really work well in the rain. And then there was like other barely there shoes, you know. So sneakers tended to work the best. But again, there must be something wrong with the shoe companies because they weren't making comfortable shoes that really like as soon as you step into it, oh, this is super comfortable to stand in and walk in, no matter what the shoe was. So there were times where I actually bought sneakers and I was like, I thought they would be comfortable. They're not. So right now, currently, none of my shoes are comfortable. So literally, you're like, while I was massaging people, it's like, I'm sorry, I don't have the best shoes to stand in a comfortable, cushiony way. Because apparently those shoes did not exist. So it's doing the best you could. So sometimes it was actually more comfortable to, you know, when I did massage people in my own office space, uh, it was more comfortable sometimes to go barefoot. And you just make sure you don't step on cords and stuff like that. And it was fine. And then it also, it's like, okay, it seemed like when you're barefoot, it was easier to be grounded. But then when you were with shoes, it made you slightly taller. So it gave you a little bit more leverage depending on the height of the table. So you have to take that into consideration too. And then again, some of the examples in the body mechanics, the massage therapist was like on this side of the table, but then massaging the shoulder over there. I basically like did it in a way where you massage the same side and then you move to the other side of the table and then you massage that side of your client. So you kind of gauge like, does this actually feel good? Is this comfortable? So I was also assessing how I felt when I was massaging people, and that kept me from getting any really massage related injuries. Now, if you didn't massage for a while, then all of a sudden you're using your thumb to work out some of the knots. If you're right hand dominant or left hand dominant and you go and you try to work with the other hand that's not used to doing that work all of a sudden, then it could cause pain because you're building up that muscle tone, because like, I'm not used to working out, I'm not used to doing this. So that's where you do have to be careful, and you have to build up symmetrical muscle strength on both sides of the body and try to make your body even. So I did try to do that where you work on both sides evenly, But if you learn to be right hand dominant or left hand dominant, you do have a tendency sometimes in the horse position to stand and work more with your dominant hand or dominant arm, depending on what's going on sometimes. So it is a challenge to be a massage therapist and work in a symmetrical way to even out your whole body. So the better thing would be is if you're thinking about being a massage therapist and you are in elementary school or high school, learn to be, what's it called? Uh, Learn to write with both hands. Try to be dominant with both hands. Learn to play sports with both hands. Try to do things with both hands as much as possible, both sides of the body. So if you do gymnastics, then do cartwheels from, your right foot first, left foot first sometimes. You want to do it both ways, not just one way, right? Be symmetrical. So I hope this video helps you if you are a client looking for a massage therapist. Right now, I have no place to work. So have fun going to all the other spas or individual massage therapists. And if you're a massage therapist, I hope this video helped you with your body mechanic techniques to have proper body mechanics so you can save your body, not injure yourself. So until next time.